Hey guys, it's Bear. It's Friday, January 8th, and this week marks 14 months since I started testosterone, and it marks 7 months since my top surgery. I started T Friday, November 7th, 2014, and I had top surgery Tuesday, June 9th, 2015. So they're pretty easy to kind of track together, which is kind of cool. So yeah, 7 months post-op and 14 months on testosterone. I haven't been doing a lot of like update videos because there's just, changes have slowed down so much that it's kind of silly to keep talking about like the same things progressing. I will be doing some tutorials on getting like your information updated. Like I just got my car title and registration finally changed over to my new name, and the last thing I have to do as far as I know is my passport. So I'm going to do some tutorial videos. It's just a matter of kind of getting paperwork in order and having the time to do it. Life's kind of really busy right now. I'm working a lot. I'm training a lot. I plan to get back into jiu-jitsu competitions coming up this year. So that's taking up a lot of my time and a lot of my energy. And then, I'm working like 3 jobs basically, so I'm just really busy. I also intend to do a review and tutorial on the Transthetics EasyP STP device, that's stand to P. I've been using that for the last like 3 months, and I feel almost 100% confident with it. I'm using it like in public at urinals and stuff like that now. So I'm going to do a video on that as well. So I've got a whole bunch of stuff coming up. You just have to kind of be patient with me if you're interested in that kind of stuff. If you're not, like, I totally get it. So yeah, so as far as like any kind of life updates, again, as far as the changes from testosterone go, it's a lot of the same. Pretty much, I've had to start doing like a manscaping routine below the belt because my legs and rear end have just become incredibly hairy. I don't mind telling you that I shave my nether bits. I always have. I just find it to be more clean and more pleasant. And the belly fur is coming in, so I like to keep that somewhat trimmed. Above that is basically like non-existent. My chest has like little blonde fuzzies, and the puberty stash is about as good as I can get. I got a little stuff under the chin, but it probably won't even show up on camera. The rest is just, again, the same kind of peach fuzz. So that's pretty much it as far as changes from testosterone. You have your typical growth, as far as muscles and, tissue growth. My voice is continuing to change from time to time, continues to drop, and I like it a lot. That's pretty much it. And then, 7 months post-op, I feel great about my chest. I'm really, really happy with it. The pain sensation on the left side is still present, and my surgeon really has no idea why that's there, and can't really guess how long that's going to take to go away. He's given me some tips just as far as, massaging the area to continue to, relax whatever's going on there. As far as you can tell, it's not a suture that's still inside. It'd be a really long time to have a suture still in there. So he's not going to go digging around. And it's just basically a wait and see kind of situation. The incisions feel so good and look so good that honestly I have been neglecting to take care of them. I was really good about putting bio oil on them like twice a day, sometimes 3 times a day for a long time, and over the last like month or month and a half I honestly just forget for up to a week at a time. It'll be every couple days and I'll remember to put it on. And especially now that winter is here, it's a little bit tight and dry, but honestly it's so comfortable that I really just forget. Everything feels really, really good. There's not really any tenderness, still a little bit of puckering at the edges, but not nearly as bad as it was right after the surgery. and the surgeon feels pretty confident that those will continue to settle and won't need any kind of revisions or anything. I am so happy with my chest, it's not even funny. I don't even think about having had surgery anymore. I don't experience any kind of top dysphoria anymore. This is like just my chest, and I love it. I'm comfortable with it. I am shirtless like as often as possible, including, at the gym and stuff. I don't really, deal with a lot of like social anxiety and stuff like that. Most everybody knows that I'm trans, or they just ignore the scars and either know what they mean or don't know what they mean. And I just don't really get nervous about that kind of stuff. I just take my shirt off and act normal, and I think that, that energy has led other people to just sort of be comfortable with it, So I'm just really happy with it. You can see that there's a little bit of puckering on the underside here, and that's really just because I had really large breasts when I had them, and I had been really overweight in my earlier 20s, so I had stretch marks. So this stuff here, the puckering, is just a result of having had those stretch marks, and that's just unfortunate. There's not much you can do about that. So it's what I have to deal with. If I'm slouching, they tend to look a little bit bad right there, but I try not to slouch. I try to have pretty good posture anyway, and stand up straight and present myself well anyway. So it is what it is. I'm not unhappy with it. And there's not really a way to make that go away other than continuing to work out and fill out the pecs and fill that out a little bit. So that's really all there is to talk about. Sorry that I haven't been doing a lot of updates. I will continue to do one just about every month, and keep letting you guys know how life is going. It's pretty typical. It's just, you have to keep living while you transition. It'd be nice to go into a cocoon for a couple years and come out and just be your authentic self and start over, but unfortunately that's not how it goes. So, as far as social stuff goes, everything's going pretty well. I have talked about it a little bit. I only have one person that really gives me an active problem. There's no way to avoid him, so I just immerse myself in it. I'm not gonna stop doing what I like doing because of one person who can't get over something. Too bad. I'll deal with it and just watch my ass. I don't think there's going to be like any kind of issues as far as like violence or confrontation, so it's just, a little bit of like social awkwardness. I avoid that person, they avoid me. Everything else has gone really well. People have pretty much 100% transitioned as far as like my name, my pronouns. I get called she from time to time by somebody who's still not up to date with it. I've talked about that a little bit. It's irritating, but it's not other people's lives. It's not in their head, so they skip a beat, and the more testosterone takes effect on me, I think the less that's gonna happen, because look at me. I don't look female, so I think it actually like people notice it more when they screw up, so that's happening less and less. And that's about it. That's my life update. So, Happy New Year, and I'll keep catching you guys up as far as any news as it comes along, and keep an eye out for those updates. Thanks, guys.